So I raise you a Zanny and 4 Percocets. Okay, what am I talking about? And I am joking. Well, I'm talking about practicing medicine in Las Vegas.
Vegas.
Welcome to Las Vegas.
And I have to say, it's a total different beast. There's things I've learned from practicing medicine here that I didn't prepare for anywhere else. So let's get into it. The first thing I call is the urgent care blitz. Now, when you come to Las Vegas, most people don't come with their own personal doctor. Well, not everyone. There's definitely some ballers out here. But that being said, you don't have your own personal doctor. Guess what you're going to do? You're going to use the urgent cares and you're going to use the ERs. Now, normally if you're at home, you phone up your primary care physician and he would treat you. Well, if you're visiting Vegas, you're not going to do that. Also, it's a very transient city. Some people come to live here for maybe 1, 2, maybe 3 years. They don't really establish care with a primary care physician. So again, what are you going to do? You're going to be waiting in the ER or the urgent care, and that system is definitely overwhelmed. Next thing is boob jobs. There's a lot of boob jobs. What am I specifically talking about? It's talking about treating surgical complications. As an internist or a family doctor, we don't learn a lot about surgical complications, but living in Vegas, you definitely learn that, and you learn it quick. Removing staples, seeing patients, seeing infections from surgery. This is something you deal with day to day, and it's just different from where I've been trained, and it's something you're going to have to learn on the fly, but yes. And actually, Vegas is becoming a surgery hotspot. We're surrounded by a lot of places that do plastic surgery. Utah is one of the #1 places in the United States for plastic surgery. California, Arizona, and Vegas is now a competitor. So that's something totally unique to the city. Substance abuse. Substance abuse goes hand in hand with nightlife. Raging, party, go to sleep, raging, party. Happens all the time in that vicious circle. And living in the city, there's a lot of vices. So you have to be able to treat them. You have to screen patients. You have to ask the appropriate questions. That is definitely unique to the city and other major cities, but it's something that every doctor should be doing. Mental health goes hand in hand with what I previously mentioned. People work in the nightlife. People get lack of sleep. A large percentage of the population deals in entertainment and nightlife, and their hours are just different. And so screening patients for mental health, making sure that you ask questions about anxiety and depression are super important while living in a city like this. The last thing I would say is the heat. Living in Vegas is like living in the second layer of hell.
115 degrees. God damn, it's right.
Especially in the summer. And I constantly have to remind patients we live in the desert. If you're visiting here, whatever amount of water you drink, increase that by 30-40% and you'll probably be good. But it's extremely important to stay hydrated if you come to live in the desert. Pro tip, honestly, if you're in the heat and you stop sweating, directly to the ER. That's the last thing I have to say about the heat in Las Vegas. It is not a joke. In conclusion, Vegas is a unique city with its unique set of problems. It's a wonderful city to practice medicine in. It's a wonderful city to live in. But you have to adapt as a doctor to the unique problems that any city has to give you. And those are my 5 things that I've learned as practicing medicine as a physician in Las Vegas.